phlebotomy, performing a venipuncture. Do you want to talk or you want me? First, she's going to attach the tourniquet and palpate for an acceptable vein using index finger, and I recommend the non-dominant hand because your dominant hand will be holding the needle. Just looking for a nice squishy, springy, soft vein. We have a 1 minute limit on the tourniquet, so she's not got her tools prepared. So she's going to prepare her tools and clean the site. Small circular motion starting at the center where she expects to insert the needle for out about 2-inch diameter. We always want the alcohol to air dry. We don't blow on it nor wipe it with gauze. Have your clean gauze ready nearby so that when you are finished you can access it. Let me see if I can get a picture of the tie and the tourniquet. Okay, so she's got her loop at the bottom and the tail's at the top. She's got a wonderful vein. Using non-dominant thumb, she's anchoring the vein, and she's going to insert the needle, bevel up quickly, and press the tube on. You can turn that a little bit, Charlene, so we can see the blood flowing in, and you watch the tube. She's pressing her hand against the patient's arm to help stabilize that needle so it's not moving. Pulling off, using the correct order of draw, she's going to insert the next appropriate tube. While the next tube is filling, she can gently invert the previous one. It takes a little while to figure out when they're full. And we're getting extra tubes here. I'll take all this out. It's starting to bubble. Go ahead and pull the tourniquet after you put that one on. While the last tube is filling, she's going to pop the tourniquet. Single hand release. Once it's completely filled, withdraw. Okay, wait till I'm ready. Okay, after the last tube is filled and removed, quickly remove the needle and apply the safety. She applied pressure with the gauze, immediately removing the needle. Do not apply pressure with the needle in. And then she will wrap up the patient's site. Ask the patient to hold it for you while she's preparing a wrap or a Band-Aid or some type of tape.